views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Copy here was really interesting to me because the question is how do, COVID-19 and the Bronx, how do we prepare for the next disaster? I don't know about you. I've had all the disasters I can handle right about now. And so the next disaster, hey, once a lifetime, this is pretty much sufficient for my personal tastes. But really, that is the story, because if, God forbid, something does happen and we do have a disaster, an environmental one or a weather one, or God forbid, another health disaster, if we are prepared for it, then it's not a disaster, right? Then maybe we can forestall some of the worst effects of it. And I think we are all feeling the absolute worst effects. It's hard to imagine anything worse, but I suppose we can. So on that note, I wanted to welcome everybody. The two organizations, both of which I'm personally associated with and very fond of. We need to thank the Northwest Bronx Indivisible and also my friends at the Northwest Bronx Community and Clergy Coalition for bringing us all together. There's a nice agenda, and it's going to involve a lot of interesting people. You may have questions, and I'm talking specifically to the participants. Those questions are welcomed, and those questions, we'd like to be able to address them during the program. I'd recommend that you use the chat function. There are people who will monitor it, not me, and put your name. If you also put your email in there, then after the fact, if we don't get to your question, you might still be able to get an answer to that question. So much like both of the organizations that are represented here, we all take what people of the Bronx say very seriously. And I certainly do, and I think my own reputation speaks to that. But also, if people of the Bronx specifically, could be anywhere, as I said, anywhere in the world. If you have something you want to ask, don't hesitate. And I know neither of these organizations have made their reputation on being shy, and neither have their members. So anyway, on those notes, I wanted to just greet you. I'm going to first thank my friend Barbara Estrin from Northwest Bronx Indivisible for inviting me to be here, and for her really strong advocacy, certainly on health and innovating new ways of handling healthcare, and also Steph Quintana from the Northwest Bronx Community and Clergy Coalition. Thank you to Steph for also leading the way to we do these things. We're going to learn how to do these better and better over time, and we'll make a good start, so to speak, today. I do want to just tell you who the speakers are, and we'll introduce them individually. But Charmaine Roddick is the project director of Bronx Health Reach. So we thank Charmaine for being with us. Judy Sheridan Gonzalez, we live in the same neighborhood, is the president of the 40,000 member New York State Nurses Association. Kamarin Nyan is a campaign director of Mekong, which aims to improve the quality of life in the Southeast Asian community in the borough of the Bronx. We're also joined today by Senator Gustavo Rivera, who's the senator of the 33rd District and chair, very important chair of the New York State Senate Health Committee. And also Katie Robbins is with us. She is the executive director of the Campaign for New York Health. So I think we're getting ready to bring on somebody other than me. Again, thank you all for coming. Use the chat box, ask your questions. We will try to find ways to fit them in. But our first speaker, listen, we talk about how to avoid disasters. We're talking really numero uno is probably health. We know what's going on out there. So let's get ready to bring in Charmaine Roddick. Before we do, I do want to add one note. I lost my mom to COVID and I know every single person who is in here, especially in the Bronx, we have all lost people who are close to us. We have all lost friends. We have all lost neighbors. I'm going to try not to cry as I say this. These are my Bronx people, and we mourn every one of them. And many people, you know, the numbers are numbers, but they also were ill, and they went through some very difficult things, and goodness gracious, we hope they've survived. But I know you all agree with me that they are first and foremost on our minds, and preventing this in the future is really what this is about. So on that note, Charmaine Roddick, I'm going to give the full thing here, is a project director of Bronx Health Reach, an organization formed in 1999 to eliminate racial and ethnic disparities in health outcomes in the South Bronx. What a task that is. It has grown to serve over 70 community-based groups, including healthcare providers, faith-based institutions, housing and service organizations. My extreme pleasure to bring you Charmaine Roddick from Bronx Health Reach. She's somewhere on my screen, wherever she is. Take it away.
Thank you, Gary. I am delighted to be here. It's such a critical time for us to talk about the Bronx and how we move forward from this pandemic. So, as everybody knows, we have in the Bronx the highest rates of coronavirus cases, hospitalizations, and deaths. As of the beginning of this week, there were 4,400 confirmed and probable COVID-19 deaths reported for the Bronx, and more than 44,000 tested positive. There was a recent New York Times article published on Tuesday, May 26th, titled, "Is the Death Towers, How the Bronx Became New York's Virus Hotspot." The bar that has the highest rates of virus cases, hospitalization, deaths. And then the question was asked, could more have been done? And the answer is yes, more could have been done at the start of the pandemic. But more importantly, more should have been done before the pandemic. The Bronx is the epicenter, within the epicenter of COVID-19, with, as I mentioned, the highest per capita of cases and deaths. It has happened, this pandemic has hit hardest those neighborhoods in the Bronx, especially for African American and Latino communities that have historically suffered from the highest incidence of chronic health conditions like asthma, diabetes, heart disease, obesity, to name a few. It should not be a surprise to most people that the unhealthiest county in the Bronx also has the highest COVID-19 rates. A county that has consistently ranked 62 out of 62 New York State counties in health outcomes and the health factors contributing to those outcomes, according to the Robert Wood Johnson Foundation County Health Rankings report since its inception 11 years ago. And many of us who live, work, pray in the Bronx know that this was so even before Robert Wood Johnson started compiling the data. In comparison to the other New York City boroughs, New York City, Manhattan is ranked number 6, Queens ranked number 7, Brooklyn, Kings County ranked number 15, Staten Island, Richmond County ranked 21, and the Bronx, of course, ranked 22. All the others have seen improvements year over year, except the Bronx. So let me introduce myself and sort of ground us in why I've been invited to talk. So as Gary mentioned, Bronx Health Reach is a 20-year-old community coalition of now more than 80 organizations. We're led by the Institute for Family Health, founded in 1999, that is Bronx Health Reach, as part of the Centers for Disease Control and Prevention REACH initiative, a nationwide cornerstone effort to address racial and ethnic health disparities unique in that the funding is to go directly to the communities experiencing those disparities for them to devise and implement their own community action plan to address those disparities found there. Early on for Bronx Health Reach, we were focused on diabetes, its prevention, effective self-management. In those early years, we emphasized primary prevention, education, and activities. But our community coalition was particularly mindful that providing them with education would not improve the health outcomes for diabetes. That where they were, place matters, geography matters. And so they wanted to look outside in the community. What in the environment is contributing to those poor health outcomes? So we got involved in increased access to healthy, affordable food, navigating a healthcare system that, particularly for specialty care in many academic medical institutions, was segregated, separate and unequal depending on one's health insurance status. We got working in schools. We looked around for increasing opportunities for physical activity. But importantly, while the Institute is a healthcare organization, actually a network of federally qualified health centers, the founding community coalition members, they were housing groups, they were churches, there were economic development groups, there were the starters of pre-K and after-school programs, there were the early bodegas. And what made them so important to this work was that they had been on the forefront of the urban renewal, the forefront of bringing the Bronx back from its early days in the 70s and 80s, when it was wildly known in using those disparaging terms as Bronx burning, Fort Apache. Those were the community groups that were intent on building new housing. Those were the community groups that were intent on providing schooling for Bronx residents. Those were the community groups that were reclaiming their street corners from drug dealers and empty mattress-strewn lots filled with drug paraphernalia and where prostitution was a regular practice. At the start, this community coalition, this band of members leading the charge, wanted to go out and hear from the community directly in terms of how they saw the healthcare system that they had access to. And people talked about battling racism in every sector of their life. They talked about how it beat them down, exhausted them. They talked about a healthcare system that disrespected them, that treated them poorly, that discriminated. They talked about a lack of trust in the healthcare system, a strong belief that they were not getting the best in terms of quality healthcare. They talked about a fatalistic attitude to the care they got in the healthcare system and to life in general for them. That is, this is all I'm going to get, so just have to take it. The Bronx is, as most of us know, the only borough where it's minority-majority population. Of the almost 1.4 million people, 85% are Hispanic and Black. It's a young population. It's also the borough where the poorest of the nation's 435 congressional districts is located. More than 29% live below the federal poverty level. We were doing better in terms of coming out of the 2008 recession. Our most current unemployment rate as of April has us back at 16+%. There is a history in the Bronx of lack of access to capital, redlining in terms of housing. Healthcare, while healthcare has significantly improved, from the days when Medicaid meals was primarily how most people got their primary care, it's still not what it should be. Economic development is happening, but for most of us who are advocates for the Bronx, know it's happening in certain areas of the Bronx, in certain communities. And the fear that we've been battling over the last 5 to 10 years is that the people in the Bronx that have the highest unemployment rates, the people in the Bronx that suffer from the poorest health outcomes, those are not the people who are the beneficiaries of changes that's happening in the Bronx.
Charmaine, if you could go for maybe another 45 seconds or so,
Sure.
about a minute, then we can move on. But
Absolutely.
Thank you so much.
So Bronx Health Reach is part of a campaign started about 6 years ago called Not 62, the Campaign for a Healthy Bronx. And when we met with Mayor de Blasio last November about the Bronx being 62 out of 62, we said to the mayor that to have any realized improvement, basically he and the governor will have to think about a Marshall Plan for the Bronx. Our motto has been in the rallies that we've had in our health disparity work group is that we cannot be 62. We can do better. We must do better. Thank you.
There we go. One of the things that we can't do, I mean, we could applaud, but I guess everybody could applaud like this. Charmaine, thank you very much. You know, much of what you said, I guess people are waving and applauding there. Much of what you said, I think many of us can relate to. I mean, these are, talking about conditions in the Bronx and who we are in terms of poverty and our health indicators. I mean, I wake up in the morning and I walk out my building, I see it every day. And so I really appreciate you putting it all into focus for us. One of the things that has captivated a lot of us, because many of us are on the outside, is what's really going on in the front lines. Of course, we all congratulate and thank our frontline heroes for doing what they do. It's actually unimaginable to me. But we're going to get some testimony from the front lines about how some of the long-term disparities in the Bronx have been exacerbated by this situation. You know, it's like you say, well, all these people have asthma. It's not isolated now. Now it's kind of highlighted and underscored. So to start that dialogue, I introduced her a moment ago, but we'll say that Judy Sheridan Gonzalez, who's an RN, is the president of the 40,000 member New York State Nurses Association. She's part of an active group of nurses engaged in transforming the organization into a social justice union. Aren't all unions social justice? Interesting question. She has worked, maybe she can answer that. She has worked for more than 30 years as an ER nurse at Montefiore Medical Center. And Judy, for that alone, we take off our hats and we thank you for everything that you've always done. But we'll introduce you now to make a presentation. I think she needs to be unmuted. Let's see if I can do that. I don't know if I can do that.
Okay, I'm on mute.
Now you are. Go
Thanks, Gary, and thanks, Charmaine, for that really important overview that sort of shapes what we inherited in this crisis. And just to give it a kind of contextual framework in terms of the situation in healthcare, specifically in the Bronx, our number 62 Bronx, the Medicaid and healthcare cuts, hospital closings, loss of beds, understaffing, a lessening of training and orientation and preparation, all in our poorest communities, like the community that we live in, the Bronx, on this federal and state level. It's not just a federal level, but state cuts have been draconian, have really, really harmed us. We started off hanging on by a thread, really, in the Bronx with the healthcare that we had even prior to COVID. And that's based on the fact that many of our patients are Medicaid recipients or Medicare recipients or a Medicare-Medicaid combination, or have not, quote unquote, the best insurance. And that's by nature, the for-profit system that we have is what delivers us this really unfair system of healthcare. So I think Charmaine talked a little bit about this, what we call in healthcare the social determinants of health, the things that give people these diseases. It's not that we have genetic propensities toward hypertension, diabetes, cardiac disease, and obesity. These are conditions of poverty. These are conditions in which we have racism, poor housing, poor education, inability to exercise safely and successfully, all these kinds of things that, access to nutrition, good nutrition. All these things are determinants, are the social determinants of what makes us unhealthy to begin with. And of course, who are the victims of COVID, aside from the elderly, and we have many, many elderly in the Bronx who are impoverished as well. All these things, hypertension, cardiac disease that I just mentioned, including also the toxic environments we're in, which is another social determinant of health, and the highest asthma rates in the nation. These are the things that contributed to our poor outcomes when it came to COVID. So again, with this for-profit system that we had, so you have that, you have the Medicaid cuts, federal, state, poor determinants of health, and you also had this system that was not since it's built on profit. We didn't have PPE in store warehouses. We didn't have ventilators in warehouses. We didn't have enough beds because they didn't make money. So we entered this COVID epidemic with that in the Bronx. Now we have the federal government with a president. I can't talk about that. We all know what we're dealing with the president and his cabinet and some of the elected leaders in that environment who are in denial or refuse to accept what's going on. Too little, too late. And then the CDC, the Centers for Disease Control, which used to be a scientific organization, which has been politicized, denying that the situation is an airborne condition, which of course now they're admitting that it was, and the lack of PPE. Thus, the healthcare providers caring for our patients were the collateral damage of a system that discriminated against our patients, meaning that we didn't have the appropriate protection, which is why we have such high rates of infection of healthcare workers in these areas. So aside from having to deal with all the horrors of the disease and taking care of patients, not having the materials we need to take care of them, not being able to protect ourselves, the trauma, the PTSD that everyone has from watching people die without being able to intervene because the disease is so poorly understood and the treatment for the disease is so poorly understood. In addition, being told you have to stay out of the room, you can't stay close to these patients. And everyone knows that the difference between life and death very often is the presence of a nurse close to a patient, and dealing with all the trauma of holding cell phones by people as they said goodbye to their families, or getting last wishes from somebody before we intubate them, knowing that they may not come out of it. These are things that doubly traumatized us. And then finally being separated from families, being treated as lepers in our communities. We have people who still haven't seen their children in 3 months, living in hotels, living in cars, the incredible trauma. And now here we are, we're talking about denying workers' comp. It's a big issue for us. Many people, we've lost 40 or 50 nurses alone, and we know that frontline providers, many have died. And now people are being told, well, if you want to make it a workers' comp issue, and you've been sick for 3 months, you have to tell us who is the patient and what day did you get this at work. They're saying that most of us got it at home. And of course, that's not true. So we have a big issue in the legislature, as the senator knows, to get a workers' comp bill passed. In addition, we really need more revenue. I think the senator is fully aware of that, because to take care of our communities and to take care of our frontline caregivers, we have to have more revenue. And we need to be taxing these ultra billionaires who should pay their fair share so that we can finance a better healthcare system. Obviously, we believe in Medicare for all, and also that can allow us to have the materials to reopen safely, carefully, scientifically, with the support that we need in our communities. Not only do our communities need economic support to survive, they need social and cultural supports. And I think Charmaine talked a little bit about that. Our communities cannot isolate like other communities. We don't have backyards. We don't have decks. We don't have we don't have big homes. We have 1-bedroom apartments with 6 and 7 people living in them. So we need those
Judy,
kinds of
if you could
supports
just
as well.
take like 1 more minute, that would be great.
Sure. I mean, my big message to you is that, there's a motto, heroes, not zeros. People who dedicated their lives should be able to get workers' comp, and our entire system needs to be changed. Healthcare needs to be changed, and we need the revenue to be able to support that by taxing the ultra billionaires who 1% of our population that makes 44 times the wealth of 99% of us. That's only fair. Thank you so much.
Judy, thank you. And of course, everybody's clapping. That's nice, silently. Judy, thank you so much. And again, thank you to you and your members for their incredible dedicated service. As I mentioned, it's unimaginable what you folks have done. And what can I tell you? Thank you so much. You know, the resources is a question that's going to keep coming up. When I walk out my door, I don't see the same thing that I see on the network television. I see people from all over the world. When I walk down the block in the Bronx, I ran around the reservoir this morning, keep myself in shape. And boy, I would love to count the number of different ethnicities I encountered along the way. And of course, that's one of the main reasons why we love our beautiful Bronx. And so, as I mentioned before, Charmaine Nyan is the campaign director of Mekong, hope I pronounced that right, an organization which aims to improve the quality of life of the Southeast Asian community in our beautiful rainbow-colored borough of the Bronx. So Cameron, nice to have you with us, and hope you're well and healthy during this difficult time.
Thank you so much for that, Gary. And again, like, thank you for our speakers beforehand, like really laying down some historical pieces, especially around, you know, some of the Bronx historical landscape and context. And then Judy alluding to the social determinants of health and talking about, like, we live in a community that has continued to suffer. And so for Mekong NYC, community-based organization here in the Bronx, organizing the Cambodian Vietnamese community, you know, one of the things that we were trying to do was really understand and how this virus was going to be impacting our community. And so I think, you know, organizations and folks on the grounds were getting hit really hard and having to shift in response in a way that we've never had, right? Really shifting and thinking about, like, how do we deal with the pandemic while also addressing the social determinants of health that's been highlighted and being magnified because of the virus. So just some of the things that, you know, Mekong NYC started to do in light of all of the COVID-19 response was, like, you know, obviously shutting down anything around, like, you know, community meetings, face-to-face outreaching or organizing. So we really had to shift and think about how we're going to check in on our folks. And so we started to do community wellness check-ins, calling up community members and seeing, you know, how are they being impacted? You know, what were some of the things that they needed? Basic necessities like access to just gloves and masks, you know, fresh produce, Asian produce, right? Something that that's restricted to their diet and something that is more culturally, you know, competent and available for them. A lot of our community members are elderly folks, and so, like, we knew that this virus would definitely hit them the hardest. So how do we do it in a safe and secure way? But then also, like, making sure that we're dignifying and valuing their needs at this time. So, you know, as we were doing these wellness check-ins, we decided to actually put together and start doing community care packages. So every week, every 2 weeks, we're actually doing deliveries to community members in a safe way, but just providing essentials. And then another piece to that was we also know, like, you know, the biggest thing around the economic hit on a lot of our community members across the board, like, folks no longer were working, folks no longer had income. And so how do we address those things? Mekong was able to create an emergency relief program where we were actually giving money back to community members just to provide for some food, you know, like really providing the safety net that we needed for community members during this tough time. And it was like basic necessity things that people were no longer having access to. So food, safe access to healthcare, you know, safety products and masks and gloves, hand sanitize. So thinking about what are some things that we can do to help support that.
Cameron, just go for another minute and then we'll move on. Thank you so much.
No problem. Thank you. And so I think, you know, a lot of our work also focuses in on, like, that health justice piece, really thinking about health equity. How do we uplift, you know, the disparities around resources, whether it's locally, citywide, statewide. And a lot of our work has been through our great partners, you know, such as Northwest Bronx and around the city, around how do we uplift those things. And I think one of the other biggest things is around, like, you know, making sure, how do we understand the impact of COVID-19? Like, thinking about the fear that people had to accessing healthcare, thinking about a lot of the loss. We lost a lot of community members because of this virus, a lot of neighbors, and thinking about what is the collective need that we need to do to really uplift what that looks like. And so COVID just magnified all of these things. And I think what we need to really do moving forward is what are the lessons learned to taking a step back and understanding how do we need to be better, more innovative and creative around what this looks like. And my last question to tie this is thinking about, like, as the country is slowly thinking about reopening the economy and opening the country, what does that then look like for Bronxites, New Yorkers, and folks across the country? How do we do that in a safe, secure way? How do we do that in smart and thoughtful, and really address those social terms of health, and then understand that the Bronx, we really want to unpack what that looks like and not being the 62 most unhealthiest county in New York State. So thank you so much.
Thank you. Cameron, and everybody's applauding. It wouldn't be me, I suppose, if I didn't ask a follow-up question. I'm very interested in it. I know you work with the South Asian community, Southeast Asian
yes.
community. Is there something in this, kind of milieu that distinguishes that community and the issues they faced in result of COVID? I mean, we have many immigrant communities. I mean, I don't have enough fingers on 15 hands to count how many different immigrant communities we have. But are there issues that were raised in your community specifically that maybe others don't have? Or it'll look like all Bronx people, you come from somewhere and these are the issues. So maybe you could just identify that so we can, locate it with your organization.
Yeah, no, definitely. I think a lot of it does come from that heart of, addressing those systemic issues. And a lot of our work has been understanding and unpacking, like, some of the language access barriers, thinking about the culture competency piece, really understanding like these continued barriers that just make it harder for communities that just can't access and navigate these systems and structures, especially around the healthcare industry, and really understanding what does that look like. All of our community members are, immigrants and refugees. And so thinking about like, how do we provide access to those that don't have those quality things? And I think, talking about Medicare for all, talking about the New York Health Act, thinking about ways to making sure that we can nip it in the bud around like providing adequate access for all of our community members is really important. And then thinking about what are some of the things that we need to do as we understand our such a diverse community, such as the Bronx and all of the folks that collectively make up the Bronx.
Great, thank you so much. When I walk around the borough of the Bronx, and obviously we're all doing a lot more walking than we normally do, I got to tell you, I see so many immigrant families, and they are together, and they bring such joy, and they bring such culture to our borough that, it's almost like to the rest of the world, how can you not see this? I think, how can you not see the benefit that we get from the Southeast Asian communities and really all the immigrant communities in the Bronx? Anyway, we do want to move ahead. Barbara Estrin wants to talk a little bit about something I think that's on everybody's mind, and that's the uncertainties. I have a friend who used to say, plans schmans, it's like you make plans and what ultimately happens, you still got to figure it out along the way. In this very complex, very difficult situation, what is certain, what is uncertain, and how do we kind of do our preparedness so we can deal with those uncertainties? And on that note, from the Northwest Bronx Indivisible, it is Barbara Estrin. Hi, Barbara. I think we need to unmute her. Somewhere.
Oh, I'm muted. Can you unmute
There you
me?
go. There you are.
Yeah.
Speak and be heard.
Thanks. You said earlier you can't imagine anything worse. And I'm here to be Cassandra. I can imagine things worse. Everyone spoke about how bad things are, but I have a few questions to raise. We base our nuclear deterrence policy, on which we have spent trillions of dollars, on the idea that we build weapons so that we won't need them. More and bigger bombs will keep us safe. But do we have a pandemic deterrence policy? As a nation, we have a history of reacting to catastrophes without setting into motion policies that might have prevented predictable next times. A crisis hits, we react, and then forget. After Katrina, we promised to be ready. When Sandy struck, New York was unprepared. After Ebola, Obama appointed a commission on pandemic preparedness. Trump disbanded it. He also relaxed all rules for environmental protection during COVID, just as we enter the hurricane season. So we worry about simultaneous disasters. Hurricane season this year is predicted to be stronger than usual. What will happen, say, to power lines that generate the computers we're using right now? In India and Bangladesh, with Cyclone Amphen last week, they fought a war on two fronts: evacuate people into overcrowded cyclone shelters, and some of them weren't in repair, and make sure they don't catch the infection. We need to prepare for double or triple whammies. A heat wave. On May 15th, our mayor put in place a heat wave policy, recognizing that the traditional cooling centers need to be adjusted. The policy includes the distribution of 74,000 air conditioners for the elderly and those in areas like the Bronx, already facing higher rates of illness because of crowded apartments. Did we need a pandemic to get air conditioning for our borough? And when papers report about who is getting sick, they still write essential, this is today's Times, essential workers, families, the elderly, poor people in neighborhoods like the Bronx. What if a heat wave comes sooner than expected? And what happens if we have a second or third wave, as they did in the 1918 pandemic? Infectious disease expert Michael Osterholm predicts we are only in the second inning of a 9-inning ball game. Statistics show that we might have saved 36,000 lives had we sheltered 1 week earlier. Are we prepared to deter a second wave when this one seems all so encompassing?
Barbara, was that the end? Or
That's the end.
Oh, okay, because I was just going to give you a 1-minute warning. So thank you very much. We could get applause for Barbara. It's always just me, I know that. Thank you, Barbara. We really appreciate it. The title of the next it kind of made me laugh, is like, how do we get out of this? What do we do? And all I could think of is the cartoon, exit stage left. Let's get out. It would be nice if it were that easy. It's going to take a commitment for a lot of us. And by the way, 2 things I want to mention. Number 1, we are taking questions. You put them in the chat. There is somebody reviewing them. And then when we get to that point in the program, we'll be able to address them. So we'll do that. The second thing I just want to talk about is New Yorkers. We see across the country that and by the way, I'm very grateful to have this microphone to be able to do this, because when I do my TV shows, I can't tell you what I think. But now I'm going to tell you what I think. I really, we have done so great. And I know you walk out and you see people without masks and you see people not doing the right thing. Go look at what happened in Missouri on Memorial Day. We don't have that in New York. And my perception is my Bronx people and my fellow New Yorkers have been great. And if you don't believe me, look at the numbers. All over the country, they're going this way. In New York, we're not where we need to be, but they're going this way. And that's because we did that. And I think we should congratulate each one of us, because that's my perception of what I see in New York. If the numbers were going badly, I'd say, we didn't do this right. But I don't know. I saw people all over the streets. And listen, maybe we're safe because we don't have high numbers now. But people are wearing masks. That makes me feel real good. I just wanted to, that was my editorial comment. But now it's time for Katie Robbins, who's the executive director of the Campaign for New York Health, which is a single issue organization advocating for a universal, comprehensive, single payer health program for our state, a program that would guarantee health justice for all. Apparently, Katie is going to do a screen thing for us. And so we're going to give her the floor and the screen for a presentation. Thank you, Katie.
Thank you. It's a pleasure to be here. Let's see, am I unmuted? Can you hear me?
You are, you're good.
Great, great. So I have the privilege of coordinating a statewide campaign advocating for universal guaranteed healthcare. And I've been advocating for single payer healthcare for over a decade now, and never in my time organizing for this has there been so much clarity about the need for this solution. So I have a few slides I want to share with folks, a little bit of insight into how we have been organizing at the Campaign for New York Health. And we're very centered around real people's experiences. As we heard today, people speaking about the front lines of working in hospitals and in their communities, working with healthcare workers and people who've been impacted by the failures of our healthcare system. We really center on people's personal stories because it helps to frankly show that the experiences someone has when it comes to challenges in accessing care are often shared by others. So when we speak out, it really, really helps to bring others on board and build our power. So we often just ask simple questions when it comes to your relationship to healthcare. How would your life change if you had guaranteed healthcare? Have you ever stayed in unhealthy jobs or relationships for fear of losing coverage? Have you ever had to choose between paying for healthcare, prescriptions, doctor's appointments, and other necessities such as rent or food or transportation? How many hospitals or clinics have closed in your area where you live or work? Are you a business owner struggling to provide health insurance for your employees? Have you struggled to access long-term care services for yourself or a family member? And I would add to this, how would this moment, this crisis of living through a pandemic be different if you weren't afraid of losing your health insurance when you lose your job in the middle of the biggest public health crisis in a century? I can't believe I have to even say that, but some of these questions and the responses we've heard to them really reveal how broken our healthcare system is. So I'm just going to ask people to think about those and how they apply to your life personally. Even though we're in this moment where our broken healthcare system feels very, very personal, there's many different aspects of how it feels to meet our needs. Now, here's a little levity for you. This is a picture of me and my husband getting married on February 2nd, 2010, 10 years ago. And we were married at City Hall, and I'm delighted to say we are indeed still married even after 3 months of quarantine. But the reason we got married on this day was at City Hall without any of our family there was actually because he needed to get on my health insurance after suffering from a kidney stone. He was uninsured. He worked multiple jobs. None of them provided him insurance. And he suffered from a kidney stone, and because he was uninsured, he actually did not go to the emergency room and suffered at home for about a week. And it was after that I said, you know what? Marriage is actually a paperwork issue, and we're going to get you on my insurance. It was a big life decision to make. We're still happily married. But I know from my work in domestic violence advocacy, that's not always the case, right? These big, huge life decisions are linked to our access to health insurance and healthcare. And that is fundamentally a flawed healthcare system. So again, like I said, we go out and talk to people all over the state about their experiences with healthcare. We've been doing this before the pandemic. We're doing it now. And here are some examples of ways that people participate in our story sharing campaign. Very simple selfies with a few sentences about their personal experiences in having their lives devastated by the broken system. So there's a few examples here that are quite powerful, and I would just encourage others to participate with the hundreds of people who have done this and consider taking a story selfie and posting it on social media with the hashtag #PassNYHealth. Let's see. So we've been out talking with New Yorkers, like I said, all over the state, and we put out a report Last year, actually, it dropped 1 year to the date today, May 28th last year, when we were in Albany for the first of a series of public hearings on the New York Health Act that Senator Rivera and Assemblyman Gottfried sponsored. And we packed the room in Albany with hundreds of people in their red shirts supporting the New York Health Act. And we shared information that we found in this report after speaking with 2,409 New Yorkers all over the state. We worked with partners all over the city and the state and the Bronx to basically ask them about their healthcare experiences. And we found, things that are shocking but not surprising, especially based on what you've heard from speakers already. Most people reported being uninsured at some point in their lives. Being uninsured is simply, a reality for 2/3, for almost 3/4 of New York residents. Uninsured rates now are increasing as people are losing their jobs and insurance. Before the pandemic, we had a little over 1 million people uninsured in New York. And now those numbers, while they're not officially out, I wouldn't be surprised if they were increasing by double, right? People lose their insurance as they lose their jobs. Now, the thing is that even when you have insurance, it does not mean that you can afford to get care. So 50% of the folks we spoke to who were privately insured reported skipping or delaying at least one type of care because of cost. So having private insurance through your job also doesn't guarantee that you can afford to use it. And what happens when we don't get care when we need it? 1 out of 3 respondents develop more serious conditions because of delayed care. And now in the middle of this pandemic, it's a matter of life and death. If you don't feel you have the money to go to urgent care or go to the doctor when you're having symptoms of COVID, it could be a fatal decision. And of course, we always get this question, how much is it going to cost? Well, here's how much our healthcare system currently costs. When compared to other universal systems around the world, you can see that the US is actually spending twice as much as the next country on our broken, fragmented system that leaves millions of people out and millions of people without the ability to afford the care that they need. These other countries are able to provide universal health care with comprehensive benefits to all residents with a very limited financial risk to the residents because it's a social insurance model of providing health care. And when people now are asking, well, actually, it's interesting. I mean, shifting from doing this advocacy work for so many years leading up to this brutal crisis moment, devastating our communities, and laying bare all the inadequacies of our healthcare system, I actually haven't been getting this question as much. How much will moving to a universal single-payer healthcare system cost? Because it's clear that we're paying more money for a broken system that is bankrupting us, that is killing us, that is not protecting our healthcare workers. That's what we're paying now for this broken system. And we put out some information linking the COVID-19 crisis to the case for the New York Health Act. And the New York Health Act is legislation that would create a universal guaranteed healthcare system in New York State. I'll talk a little bit more about it. Like I said, the COVID-19 pandemic is revealing how broken the healthcare system is. So right now we have a system that is rationing care based on who can afford it. People are delaying or skipping medical care because of cost. The New York Health Act addresses that problem because everyone is covered and no one is charged costs at the point of delivery, right? When you go seek care, the first question will be, how are you feeling? Not, how are you going to pay for this today? There won't be any fear that if you have to stay home sick, that you would lose your job and then your insurance. Every resident would be covered. Healthcare access would not be tied to things like your employment status or your marital status or your income status or your immigration status. Every resident and worker in New York State would be covered. And because the New York Health Act would put an emphasis on preventative care, primary care, so that we have the ability to stay healthy, even when we're not in the middle of a pandemic, that when these kind of public health crises hit, we don't have the incredible disparities that are playing out now and resulting in people in communities like the Bronx being so much higher risk because of the comorbidities that they suffer with even before this public health crisis. So we are committed to continuing to fight for the New York Health Act. The principles behind this bill is that it is universal, it covers everyone, that it is comprehensive, it is better benefits than any public or private plan that currently exists. I'll just list some of these because it's always asked, but yes, it would cover your choice of physician, of hospital. You would be covered for mental health.
Excuse me, Katie, if you could just do like 1 more minute or so, or
sure, no
condense the
problem.
end, that'd be great. Thank you.
No problem. We would treat your eyes, your ears, your teeth like they're part of your body. You know, they would be covered. The financing of this would be like a sliding scale based on what you can afford to pay rather than what the market will charge you. And it's publicly accountable to the people as opposed to private insurance company stockholders. And importantly, everyone has a meaningful voice in the decisions about their healthcare system. Right now, we don't have as much impact on how our healthcare system is organized, and the New York Health Act would change that. So I'm going to wrap up because I know we have more people to hear from today, but I just want to shout out all the incredible organizing that groups like Northwest Bronx Community Clergy Coalition, Mekong, and others have done. Here you can see the New York State Nurses Association prominently outside of the public hearings that were held in the Bronx last year, and how critical it is that we continue to build this movement. And I look forward to talking about all the ways we can do that in the Q&A. Thank you.
Unmute. There we go. Ms. Robbins, thank you. Applause. There are people applauding and waving. I guess that's the new way to do it. But thank you very much. We could go another 15 minutes, I assure you. Let's also remind people we're going to take questions, I believe, after our next speaker. We're going to be actually going through questions. So this would be the time to submit them so they can be reviewed, and also we can get it together so I can present them. The last time he was on Bronx Talk, I probably asked him some of the same questions we're going to get to right now. The next speaker is State Senator Gustavo Rivera, representing the 33rd District in the Bronx, chair of the New York State Senate Health Committee, Senate sponsor of the New York Health Act, for which he has tirelessly campaigned. All right, you heard all the problems. Go ahead, Mr. Elected Official, solve them. Come on, wave that magic wand, make something happen.
Well, first of all, Gary, since we're not on Bronx Talk, it means that not only do we get to hear what you really think, like, because here you're not a journalist here, you're just a moderator. But also I get to curse if I want to. I'm not going to, because I know. We're on BronxNet. I get it. Anyway, good afternoon to everybody. There's a lot that have been said. Gary, one more thing. You're not going to have to give me the 1 minute warning, because I will actually be extremely brief, since you just reminded me that there will be questions afterwards. What I really want to get to are the questions. And I know that Dr. Faulkner is on this, and he's wearing his lab coat. We already know with that amazing mustache that you are official, sir. But we're going to get to some of those questions. Look, I have a lot has been said already. We had folks that set up the stage for what we're talking about as far as the history of the Bronx, the historical inequities in the Bronx. We've talked about the broad-based how basing a system on the idea that healthcare is provided. Because, by the way, remember, right now we have a system in which it is not about whether you're employed doesn't mean that you have healthcare. It means that you might have insurance, and insurance is not the same as providing care. And so I will only say a couple of brief things. As a plug, by the way, completely separate from this, at 5:30 today, we're doing a remote learning education and summer activities during COVID-19 webinar. That's at 5:30. So I am on this Zoom thing all day. I was doing stuff this morning in the conference for the session, and now I'm here, and then I'm going to be on that one. So if you want to, at 5:30, if you want to talk about remote learning, education, and summer activities for your kids during COVID-19, go to my Facebook page and look. That webinar is going to be 5:30 to 7, so hopefully you can join us. But on this one, I will say this. This situation that we find ourselves in is just a way, what it has done is just demonstrated things that were broken in the system and we all knew were broken. We got to ignore them because when we went to the supermarket, we had like 200 different types of cereal to choose from. So we didn't have to think about the fact that there are so many people who have the situations that we're seeing right now, people who through no fault of their own find themselves uninsured. Individuals who are insured are still going to have to fight their health insurance companies regardless of the crisis. One of my staffers, her sister, her older sister, in her 30s, young woman, healthy, caught COVID-19. And by the way, Gary, I did not know about your mom. My sincere condolences to you and to your family. But this young woman caught COVID-19, was eventually put on a ventilator, was in a medically induced coma, got out of it and has recovered, and now has gotten a bill from the hospital for $400,000. And that's just one situation. So we need to move away from the system that we have right now. The folks that continue to defend the system that we have right now are ignoring how blatantly the situation that we're in demonstrates that we are only as safe and as protected as the least among us. And if we do not have a system that is universal in nature, if we don't guarantee universal coverage, then we're not going to be able to deal with this issue in a real way. We're only going to be pushing it off to later. I would remind you that places like South Korea, like Australia, like Taiwan, they were able in a very big way to deal with this issue because they had a system that guaranteed healthcare to the people in their countries. So if you believe that we don't have a responsibility to each other, if you believe that if somebody is not wealthy enough, then they should not receive coverage, then I got nothing for you. If you believe that that is ultimately that if somebody can't afford care, then screw them, then basically we can't have a conversation. But if you believe that we have a responsibility to each other, and if you believe that if you're human, you should have access to care, then we need to do this. And last thing I'll say before we move on to questions. Is this complicated? Yes, it is technically complicated. Is it going to be expensive? Yeah, but guess what? The system we have right now is expensive already, and we're not getting good results. And I would argue that the situation that we're living in right now is far more complicated and more expensive and more deadly than if we had universal access. So that is what I'm working towards. I want to make sure that we do it in New York. This is not about an opportunity. This crisis does not present an opportunity. It underlines our obligation to push for bold solutions. And I'm looking forward to it. You don't even have to give me the minute, Gary.
There you go. Thank you very much. I do want to follow up, Senator, with a question for you. As regards you saying that it's expensive.
Yes.
But my thought is that if you take out, the middleman or the big man, the corporate aspect of it,
yeah,
and then yes, we'll be paying into a system, but wouldn't it ultimately be less expensive?
It would save.
There's a lot of dialogue about this, but
yes,
it just makes logical sense to me.
The system saves, like moving to a single payer system saves a lot of money because number one, you're sharing the cost among the entire risk pool, right? So you're not doing it in any insurance product, right? It refers to a risk pool. If you are employed and your corporation, the company that you work for has 100 employees and they're all insured, that is the risk pool that company is paying for. So if you make the risk pool 20 million people, all of a sudden you're sharing the cost among everybody, you save money. Number two, you cut on administrative costs because you're not paying high salaries for executives and you're not paying for all those people who you call who tell you that you're not covered or who fight with your doctors on a day-to-day basis. You save money there. Number three, you provide primary care to everybody because individuals that do not have primary care now, they still get sick because they're humans. And when they go to the emergency room, that is not only not the highest quality care, but very expensive as well. And fourth, you save money by being able to take the entire population and negotiating with drug companies for drug prices that are lower. If you're saying as a state, we negotiate on behalf of 20 million, as opposed to say 1,000 employees or 500 employees, et cetera, the prices are going to be lower. So sharing the risk, saving money on administrative costs, primary care for everybody, and you get, and you save on drugs. And lastly, by the way, because you're providing primary care, you're actually lowering morbidity and mortality. So not only are you making life better for people, it is cheaper to take care of people who are healthier than to take care of people who are sick. So overall, it would save billions of dollars. It would save billions of dollars. It would save billions of dollars and would provide better care.
Boy, that sounds like win-win. The last time Judy Gonzalez was on Bronx Talk, I believe I pulled out a medical bill that I had gotten that was almost like a comedy routine. It was like, they billed for $3,000. I don't remember it. I don't have it in front of me. They billed like $3,000 for some care that was important care. But then, it was like somewhat arbitrarily discounted. And then as it moved down, it was, the insurance company paid something, even though we're paying that insurance company. They didn't take care of it all. And then as it washed out, we ended up with a $120 bill. I was like, well, why not just discount it another $120? Why are you sticking me with that cost? It's all like made up money anyway. Mm-hmm. And so eliminating that middle concept, yes, that somebody can just set prices. I also am aware of— Not
only set prices, by the way, just really quickly here, not only set prices, but determine what networks you're in, because you don't get to do that. If you got into an insurance product, the network is determined by them, not you. So you might be going to a doctor forever, and all of a sudden, whoop, for whatever reason, that person's no longer in the network, you're out of it. And second, what drugs, if you have a health insurance plan that actually covers drugs, the formulary, the things that they do pay for is also determined by the insurance company. So this notion, this silly notion that by moving to a single payer system, we're taking away choice, it is a perfect PR. It is a public relations messaging strategy that's bull crap. See, I did not curse.
Thank you.
I said bull crap.
I know it was on your mind.
Huh?
I know it was on your mind.
It was close.
Yes. It really is kind of an unbelievable thing that it can't be done, or it hasn't been done. And the first question that we have here feeds on it. And so we're going to ask Ms. Robbins and also Senator Rivera. They can each have a handle on it. I guess, Senator, it's really for you. Where is the New York Health Act at now? And what is it going to take to get it passed? And how even moderate Democrats are not behind it. And of course, certainly on the other side of the aisle, they are not behind it. Is this simply a political advocacy, or is there something else at work here?
First of all, there's 63 members in the Senate, and right now there's 31 of them, including myself, who are co-sponsors. So I'm terrible at math, but we need one more. So we would have 32 would be the majority of the Senate. Now, I repeat, nothing happens without political advocacy and building momentum. It was, power concedes nothing without demand. It never has, it never will. That was, I forget the brother who wrote that in the 19th century. But so the issue here is we have to build momentum. You remember marriage equality, which we all right now take for granted. I can officiate weddings. I've been able to officiate weddings for years, and I've married a few couples, both straight and same-sex couples, which have been amazing. But remember, that had to build over time, right? So marriage equality had to do that. This governor, for example, was the same governor that a few years ago, when de Blasio was running for mayor, was saying we need to raise the minimum wage to $13 an hour. And this governor, Cuomo, said, oh, that's a laughable thing. It's not even a starting point. And then years later, because he was pressured to do it, he became a champion for 15. The same governor who years ago said, marijuana, we're never going to have legalized marijuana, medical maybe, but legalized. And now he's saying that he's going to fight for it to happen this year, the same governor, because he was politically pressured. So I would say that it is all about building that momentum. And I would hope that the situation we find ourselves in right now, and this is what I'm telling my colleagues, I'm talking to them both publicly and privately. Frederick Douglass, thank you. Frederick Douglass was the one who said it. Thank you for reminding me. I do not want to take credit for something that was not mine, particularly something that brilliant. Point is, I'm talking to my colleagues and telling them, please see the situation right now and tell me how this is not something that makes the case for universal health care. Like, and ask yourself whether this is something you should be fighting for, and I think you should. And some people are being nudged along, but I'm going to continue my battle. I know Katie continues her battle, and everybody on here, I know will do a little bit of nudging on their own.
We will bring in Katie. I just want to mention one thing, about the whole notion of pricing. There was a study, and I know it was a Bronx hospital. I don't want to finger anybody unless I have it right in front of me. But basically, they went in there and asked, what are the prices for some of it's very complex, the various types of care, and there really was no price list. And so when you see your bill, it's, as I said, it's coming up out of the air. And then, of course, they're all negotiating it on your behalf and deciding what you end up having to pay.
There's a term for it. And I forget what it is, but there's a term of art in the hospital industry for the catalog of prices that each hospital sets internally. And they don't share it. Well, but there is, I don't remember the name of it, but it's like there's things online about it, but it's incredible that you can have two hospitals which are a couple of miles away from each other with equally, as far as the type of success that they have in this particular procedure and recovery time, etc. And one's price is right here and the other one is right here, and you have no reason.
Makes no sense. Judy Gonzalez just mentioned that it's a Ponzi scheme. Kind of an interesting way of looking at it. Katie Robbins, the question was directed at you. We'll give you a shot to have input. Thank you, Senator.
So going back to the question, could you repeat it for me?
Sure. It was basically, what are the next steps to get it passed? How do we, move the needle politically, whether it be the governor, whether it be moderate Democrats or others, to say, you know what, this kind of makes sense.
Right. So we've looked at this as both a legislative battle, right? We need to pass legislation, and I'm very proud to say it's passed in the Assembly 4 years in a row, and we're near majority in the Senate. But this is huge. This affects everybody, what we're talking about, a universal healthcare system that is high quality, covers everyone, because we all need to have a stake in how this runs. And so it's a movement building issue as well. So where we're at right now in the scheme of movement building around pushing this on the state level, really it's just been in the last election cycle that it became an issue that we saw candidates running on very explicitly. Why? Because we had a movement big enough to get it on the radar there, right? We need to make sure that we're doing all of the necessary movement building activities so that we have a force strong enough to make the levers of power do the right thing in Albany. We know we have friends in Gustavo Rivera and Dick Gottfried. The governor has not been a champion of the New York Health Act. The governor has been very much siding with big hospitals, for-profit nursing homes. We're not feeling a whole lot of love coming from his office on this issue. But we also know the kind of governor he is that if we build the movement to be big enough, it's like if we have that huge parade that the governor wants to run to the front of the line and then tell the story of how he's always been with us. Okay, we know we have the kind of governor who will do that if we do the work to make sure that the movement is big enough to get us there. So some of the things that we talk about doing, like I said, the storytelling project, even in this time of social distancing, we have trainings and opportunities for people to speak out and talk about how the system is affecting them, and all over the state, in New York City, in the Bronx, but also upstate, truly a statewide movement, building pressure on all elected officials to get this done.
Thank you very much. Folks, I hope you're getting a chance to read some of the chat comments there, because they really are very, very interesting. We can't get to all of them, but
can I say something, Gary? Am I?
Yeah, sure, Judy.
Can I intervene?
Of course.
Yeah, I just want to talk about the myths that we get fed, that is really important.
We do want to move it because there were some other questions about other issues.
No, just because I'm seeing some comments with, Vermont couldn't pass it because of the money. I mean, in general, you'll hear, and I think somebody said it, if we had a $15 minimum wage, the myth was that all businesses would leave New York. Obviously, that didn't happen. We have this $15 minimum wage as an aspiration, and soon will be. The same thing with Amazon. We can't give them the tax breaks. Oh, you're going to lose 20,000 jobs. Amazon's going to leave. Amazon's back with paying taxes. Same thing with healthcare in Canada. All the doctors are going to leave. All the doctors didn't leave. People are saying that. I just think it's really important with this fear thing that the enemy puts forward, that everything, the hell is going to happen if we do this. And that never worked in anything that we've ever asked for. And I just think people should keep that in mind when your common sense tells you something works, and the people who don't want it to work tell you the horrible thing that's going to happen if we do it. I just want people to remember that. I appreciate
that. That is why I did the follow-up with the senator to say, he said it was expensive, but let's really talk about, really expensive on one end, but not necessarily on the other. Anyway, we want to move the dialogue. Michelle in the chat addressed the issue of interpretation and also generational trauma in immigrant communities. So she's wondering if the panelists can speak, and I guess that would be you, Mr. Nyan, to speak about access to language justice during this pandemic. Imagine being in a hospital bed in a desperate situation and not being able to communicate with the nurse or understand what they say. I can't believe it.
Yeah,
so
very
Mr.
much
Nyan,
so.
That's you.
Yes, no, definitely. I think that's one of the biggest things that we always run into, especially in our line of work, whether it's helping community members access healthcare and health services. We always run into the language access piece, and we've been supporting a lot of coalition work specifically around language access. So right now we're actually part of Visible No More campaign, a 15% and growing campaign that actually fights, and some of the priorities is addressing like disaggregating data, language access, specifically speaking to some of these things around cultural competency, making sure that there's language providers, especially interpretation. Like we have phone line interpretation, and I think part of it too is like making sure that there's skill and capacity for actually having access to do those type of jobs. And then the health equity piece is really important, making sure that there's resources for those things. So I think it's always going to be a challenge, especially if there isn't the folks that are there that has the skill to provide specific language capacity. But I think that's something that Maycon continues to push as we want to uplift. There are plenty other limited English speaking communities that need that kind of support.
Folks, we're just about out of time. I'm getting messages that we got to start wrapping it up. So maybe we can, if Charmaine wants to address this, they would, if she can do it really quickly. We're talking about the contact tracers in the African American and Latinx communities. How can that work? And do you feel confident that in those communities, in many cases, there are undocumented and there are also people in crowded apartments, that these things can be done? So maybe Charmaine could answer that for 1 minute, and then we'll wrap up our program. Is Charmaine there? There we go. Here she is. You need to just unmute yourself, and if you could do about a minute on that, and then we'll wrap up the program. I think she needs to there we go. Charmaine, are you with us?
Hi.
Okay. So did you want to just address your forecast for how contact tracing will work in some of the communities of color in the Bronx?
I'm sorry, Gary, could you say that again?
Sure. Just address the notion of contact tracing in some of the communities in the Bronx, especially communities of color, where it may be a little more difficult to, identify various things in people.
So let me be fully transparent. I am just sitting on the community advisory board that the health department and Health and Hospital Association, am I saying that right?
Yes.
Are sort of leading the effort, and I've been invited to sit on it, of course, because I lead the Bronx Health Reach Coalition. So the concerns that I have raised, and I actually put it in the chat, is how in the planning of it and the execution, is there a really pointed attention being paid to its equity in terms of not only its implementation, but also in paying attention to in who is going to be policing it, for want of a better word.
Well, maybe you're going to end up being that person on our behalf in the Bronx. Listen, we are almost out of time. I do want to mention the organizers, which is both Northwest Bronx Community and Clergy Coalition and Northwest Bronx Indivisible, have asked people to take the following actions: requested Senate and Assembly leaders, which would be Carl Hastie and Andrea Stewart-Cousins, not only call the legislators back to Albany, but also extend the legislative session to make up for time lost during the Albany quote-unquote pause. Also demand that legislators bring the New York Health Act up for a vote and implement it as soon as possible. And listen, volunteers, even like what you're doing today, is volunteering. Tell your story, measure the impact of COVID-19 on healthcare in New York City. And there's a link on your screen about that. And or join a training session to learn how to tell your story effectively. And I guess we're going to bring on Stephanie Quintana to wrap up the program. I will thank you very much for joining us. If you didn't get your question asked, it is in the file and there will be people getting back to you. But just thank you for your kind attention. By the way, I'll be moderating a debate in the 15th Congressional District and also in the 16th Congressional District. Then they'll both be on BronxNet next week. So that will be exciting. So
looking forward to that one, dude. I'm looking forward to those.
People are looking forward to all of them. So Stephanie, take it away and wrap us up.
Yes, thank you, Gary, so much for amazing moderation. Thank you for our partner organizations and our speakers for such amazing, insightful work that you brought forward today. I'm really excited for this type of conversations where we get to really come up together and bring ideas and think about solutions that are coming from the people in the Bronx. So I just wanted to quickly end our time together with another invitation for you to join us tomorrow. The Northwest Bronx Community and Clergy Coalition, we have our monthly meetings in person. We miss them deeply, but we have adapted to virtual membership meetings, and that's happening tomorrow, May 29th, at 5 p.m. We're finishing at 7 p.m. Last time we even had a dance party after our meeting and it was fantastic. So from 5 p.m. to 7 p.m., we will be talking about an amazing Bronx-wide platform that we've been organizing with other partner organizations as well. And then we will also discuss the June 23rd election and how to get the vote safely. The voting is not canceled, folks. So come join us tomorrow for a conversation about the Bronx-wide platform. If you want more information, please contact me at stephanie@northwestbronx.org. Again, Stephanie, bring your pen, your pencil, write it on your notes of your cell phone. Stephanie@northwestbronx.org. We will love to have you tomorrow in our meeting, and we will follow up for those folks who we didn't got to answer your questions. We're so appreciative of the time that you have given to this event. So thank you, everyone. And I think that we did it. This is it. Thank you, everyone.